Spring break is right around the corner. A lot of people are already looking ahead to their summer vacation. Some may be considering cosmetic or plastic surgery ahead of their trips. And now is the time to do it because your body needs time to recover. Joining us this morning is Dr. Adam Weinfeld from the Seton Institute of Reconstructive Plastic Surgery. Thank you for joining us this morning. What are some of the more common procedures that you're seeing being done?
Yeah, well, thanks for having me. The most common procedures, surgical procedures that is, are rhinoplasty, liposuction, and breast augmentation. And they vary from year to year, but those are the top three.
And recovery obviously is so critical after the procedure is done. What are your tips for quick recovery?
Absolutely. Well, in my practice, the most common procedures are facelifts and rhinoplasty. Those are procedures in the face. The face is very visible after surgery, so we definitely want to maximize the appearance of the face in the short-term follow-up period. We do that by controlling swelling and bruising during the recovery period, and to do that, you need to control everything leading up to the surgery. So I place my patients on a special diet before the surgery. I always hand select the anesthesiologist that I work with so they can help modify the environment of the patient during the time of surgery, and then I control the diet of the patient afterwards. In addition to that, there are a bunch of non-prescription and to some extent prescription medications that I ask the patients to avoid in advance of the surgery. And then there are some supplements that I have the patient take in advance of the surgery and subsequent to the surgery to help reduce swelling and bruising.
So it's a very intricate process, obviously. Are there certain procedures that have a longer recovery time than others, or tougher?
Yeah, intricate is absolutely correct. My mantra is control everything, deliver excellence. And in order to do that, you do need to control everything. The diet that I spoke of, I have patients try to stick to lean meats, to vegetables and fruits. A lot of people don't necessarily know this, but carbohydrates that come in a grain form are extremely inflammatory. So for 2 weeks in advance of, let's say, a facelift, and for 2 weeks afterwards, I have patients lay off of those particular food substances. Another thing that many people know is that salt can cause swelling. So if we ask people to stay away from prepared foods, canned foods, fast foods in advance of their surgery for 2 weeks and 2 weeks afterwards, they tend to recover well also.
What's a typical recovery time you're looking at?
Well, I think we have some photographs of a patient at 5 days, and and you'll see that's a patient who, on the left, that's the preoperative photograph. On the right, that's the postoperative photograph, and you can see that at 5 days, you can see very nice results, but it's very difficult to see any bruising. I'm not sure if it shows on this particular photograph on television. There's a very slight ring of bruising around the neck, but very little swelling, very little bruising, and that's because I controlled her whole physiology during the time leading up to surgery, and afterwards in order to decrease the oozing of blood during the surgery.
So it's all, it all works together, obviously, and the recovery time is sped up as long as you follow the right directions. And
there are there are many things that that people need to consider avoiding. And a good site to go to do that is to go to look at the blog segment of www.cosmeticconnect.com, because there's literally hundreds of them. And I don't want to give medical advice on the television in a broad way, but there's some good general recommendations at that particular location.
Also want to tell people to go to www.setonplasticsurgery.com for more information. Thanks for being with us this morning.
My pleasure.
All right.
Yeah, thank you.